System-wise history, for a patient with fever, Part 2. Central nervous system. Meningitis, classically presents with headache, vomiting, neck stiffness, and fever. Some forms of acute bacterial meningitis can present with a typical purpuric, non-blanching rash and may be associated with severe sepsis and shock. Viral meningitis is usually less severe and self-limiting, and often begins with symptoms of a viral infection, such as fever, malaise, headache, and muscle aches. Head injury and neurosurgery may increase the risk of meningitis. Chronic meningitis presents with the same symptoms as acute, only over a more prolonged period. Associated features should be sought for the more common causes of chronic meningitis, including tuberculosis, cryptococcus, and Lyme disease. Encephalitis is inflammation of the brain tissue, resulting in altered levels of consciousness, headache, and fever. Additional symptoms may be present, depending on the site of infection, and include seizures, tremors, stroke, hallucinations, and abnormal behaviors. Intracranial abscesses include brain abscess, subdural, or extradural empyema, and are usually bacterial in origin. These abscesses occur, secondary to seeding, from a primary site, either from a contiguous one, such as in otitis media, sinusitis, mastoiditis, or dental infection, secondary to hematogenous spread, from a remote site, such as endocarditis, after a head injury, or neurosurgery, and rarely, following meningitis. Not all patients with nervous system symptoms and fever have a primary nervous system infection. Some systemic infections can cause neurological symptoms, such as severe or cerebral malaria, neurologic signs in severe typhoid fever, and meningeal signs in HIV seroconversion illness. Skin and soft tissue. A detailed history of any skin conditions should be sought, even if this is not present at the time of consultation. The presence of a rash is more likely to suggest a systemic than localized condition. Remember to ask about any insect or tick bites, as rashes following a bite could indicate a vector-borne disease. It is important to distinguish a generalized rash illness from a localized skin or soft tissue lesion. The latter is more likely to be asymmetrical or unilateral, involve tissues deeper than the skin, affect surrounding structures, and be associated with localized enlarged lymph nodes. Some examples of localized infections include impetigo. Impetigo is a contagious infection caused by staphylococci or occasionally streptococci, found mainly in preschool children or in other ages, associated with playing contact sports. It usually starts as a small pustule around the nose or mouth, which bursts, oozes fluid, and leaves a golden crust. Cellulitis. Bacterial infection of the skin, involving deeper structures, most commonly affecting the leg, rarely bilateral. Certain groups of people are at increased risk, including diabetics. It can affect any area of the body, and facial cellulitis should be managed as a medical emergency. Necrotizing fasciitis is a severe and rapidly spreading form of cellulitis. It requires urgent surgical and antibiotic management. Musculoskeletal system. Joint infections. Joint infections occur in both native and prosthetic joints. A history of joint replacement or joint procedure, such as arthroscopy, increases the risk of infection developing in the joint. In a patient complaining of arthralgia, one should distinguish between monoarthralgia and polyarthralgia. Monoarthralgia is more likely to be a septic arthritis in the affected joint, while polyarthralgia suggests a more systemic disease. Osteomyelitis occurs as a primary infection or secondary to an overlying skin or soft tissue infection or previous surgical procedure. Osteomyelitis is associated with bone pain, swelling, deformities, or pus draining through the skin. Adult onset Still's disease. AOSD presents with a classic triad of persistent high spiking fevers, joint pain, and a distinctive evanescent, salmon pink, macular, or maculopapular rash that peaks with a rise in the temperature. The classic fever pattern is 1 or 2 daily febrile spikes exceeding 39 degrees centigrade, usually occurring late during the day. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.